Welcome, everybody. I hope you'll use the chat. Tony's going to be monitoring that, and we'll all kind of switch off. I'm Milena Esherick. I'm a licensed psychologist. I'm here in Oakland, California. I ran a graduate school for a lot of years, training marriage and family therapists. So that's how I got very interested in this topic. Pass it along to my colleagues to introduce themselves.
Well, hi, I'm Hanna Levenson, and I'm also a licensed psychologist in the state of California. I'm professor emerita at the Wright Institute here in Berkeley, California. And I've had a very long-term interest in supervising and training. This is my 50th year actually being a supervisor. So I'm really just having my eyes open by dipping into
One
AI.
of the people
Great.
giving.
And yeah, I'm in the background is Alex and Tony from Sentio University, and we are just happy to have Milena and Hannah. We at Sentio have been doing some research on AI in the field of mental health, and Milena and Hannah today are gonna share with us their thoughts and what they've been up to for AI and supervision. So we'll be in the background. If any of you have questions as we go along, you can feel free to put them on the Zoom chat. Tony or I will kind of address those. And Milena, Hannah, feel free to take it away.
Thank you. Thank you for having us. And Hannah and I will shift on and off. And yeah, Tony and Alex, jump in as you get inspired. So, first question, why are we talking about AI and supervision? Why this topic now? What really hurts my heart as an educator for 20 years is the research that says how we've been training and providing traditional supervision isn't reliably connected to client outcomes. That's distressing to me. So, Sentio is really working on deliberate practice as a new way to enhance clinical training. And now we have this other tool of AI that I think can support clinical training as well. So, was really frustrated as an educator, and I'm really excited about the possibilities with AI, which is what we'll explore today. Traditional supervision has a lot of limitations that we're familiar with. Very high cost. I live in the Bay Area. It can be several hundreds of dollars to seek consultation from an expert, few experts that we have access to, limited time with them. We may have full caseloads, 10, 20, 30 clients we're seeing in a week, and we might see a supervisor for 1 hour, a couple hours a month in a consultation group. I don't know about others, but I have a million more questions after every session. We also have the challenge of supervisees and students self-reporting what's happening in session. We rarely get to observe and see their clinical work directly or to review their clinical tapes. It's too labor intensive. It's not really possible. And then we also have the reality of students coming to work with supervisors and that power difference. It's anxiety provoking. There's going to be withholding of information. So, for a lot of these reasons, there are some places where AI might be able to assist us in improving the way we've traditionally been doing supervision. And it makes sense that AI would get integrated into our clinical work and clinical training and our educational institutions because it's integrated into everything already. Whether we are aware of it or not, AI is functioning in the background. And what do I mean by AI? AI is this very broad, encompassing term that means a machine that can do human-like things, things we thought only humans could do, like write poetry, write our emails for us, generate images and videos, drive cars, simulate empathy, provide therapeutic interventions. It's quite remarkable. And then when we talk about LLMs or large language models, what we're referring to is kind of the newest tool in the AI toolbox, which has given the general public a lot of access to be able to talk to machines. We don't have to know how to program or code or be a computer expert. We can use our words to talk to machines. So where are we next? It would make sense that most of us are pretty Still skeptical. Yes, AI is all around us, but what does this have to do with clinical work, with supervision? So I want to just have a few slides to highlight what our professional organizations are saying about AI to hopefully relieve some tension and anxiety that this is okay for us to be having this conversation. So I think the American Counseling Association has some of the most detailed recommendations broken down by your role. Are you a student? Are you a faculty? Are you a supervisor, a researcher? And how do we want to be thinking about AI? So, and they come right out and say supervision can be enhanced by the use of AI. And here are some tools that can help. And we'll go over some of those tools today. The American Psychological Association also says that AI is going to impact everything we do, our education, our training, our clinical work, and our research. And then what we really want to keep in mind as we're moving through this conversation is that we're not at a place where we are expecting AI to function independently. We are integrating our clinical judgment, our knowledge, our expertise with the data, with the outputs that we get from AI. So hold on to that theme. And Hanna, you've got the next slide.
All right. So here with this diagram, it will allow me to say that there are different levels where AI can play a role in supervision. So first we have assistive. So this is your car. You are driving the car fully. In my car, if I start putting on my directional and plan to move into another lane, I get a warning sign, a warning buzzer, if in fact someone is driving in my blind spot. So that would be like assistive for the operator of the car. And a parallel to that might be AI doing session notes, purely as like almost an administrative assistant to the driver, to the supervisor. Then we have collaborative, which is, yes, the car can do some things by itself, like it could parallel park or maybe drive somewhat, but you have to have a fully functioning operator behind the wheel because the car is not totally reliable and you would have to be prepared at a moment's notice to take over. And this would be similar in supervision where we have supervisors who could ask AI about treatment plans, possible interventions, actually be a thought partner in terms of conducting the therapy, but that the supervisor would review these and certainly not just automatically assume accuracy. And then finally, we have the autonomous, the car that drives itself. Here in San Francisco, we have a number of Waymos driving the streets, and you can just rent one and get in one, and it will drive you where you want to go, and there's no one in the driver's seat. I have to tell you, the first couple of times, it's unnerving. But this would be similar in supervision where we have AI tools that are now operating without the supervisor's presence. The supervisor may suggest these tools, or the supervisee may find them on their own, but they operate independently of any on-the-spot supervision. And I'm going to be actually talking about a few of those autonomous tools so you can get an idea. Milena and I were invited to do a workshop at an international supervisors conference at Rutgers University last June. And this is where supervisors come from all over the world to learn about what's the latest going on in the field of supervision. So very dedicated supervisors. And we decided to do a survey since we had this
Sorry, Hannah, you got muted because I needed to mute everyone. Please unmute yourself and continue. There you go.
And so we decided to do a study on the attitudes and behaviors toward AI of these supervisors. 63 supervisors participated in our survey, and in general, most use an eclectic approach. They provide 1 to 2 hours of supervision a week. They work in a private practice with adult clients. In terms of demographics, About 2/3 are female, 3/4 are white, 11% Black. And here's some of our results. And this is the first time we're presenting the results, so I'm really excited to share them with you. I am knowledgeable about AI, and it goes from strongly disagree at 1 to strongly agree at 7. And here we see that about a quarter of the people responding are, I'm going to try and use this pen, a quarter of them here are strongly or somewhat knowledgeable about AI, but that leaves the vast majority not knowledgeable. We asked, I expect AI tools to become common component of clinical supervision within the next 5 years. And here we see that 75% of the respondents were on the positive side of the continuum. Yes, it's going to become a common component. Oh, I need to get rid of those circles. They're just staying there for everyone. I have no idea how to do that. Well, let's pretend we'll just ignore it. Sorry about that. I believe using AI tools in supervision could improve supervision quality. And here we have 2/3 of the respondents saying yes, they believe somewhat or strongly that AI tools could improve the supervision quality. And I am familiar with AI tools for supervision. And here we have just the opposite of all the interest and the potential. In terms of familiarity, we see that 80% of the respondents have very little or absolutely no familiarity with AI tools for supervision. And I do want to highlight that these are supervisors who traveled a great distance to go to a supervision conference. Now, supervisors have mixed feelings about AI, as you can imagine. I think AI will support our work if we're not afraid of it. I'm worried that using AI beyond the most basic will dull my skills. Now, you all remember the days before COVID, and when we had to make that extremely rapid shift about 5 years ago to telehealth. We were all getting on Zoom, scurrying around to find out, how do we supervise on Zoom? How do we see patients on Zoom? We were very skeptical. Was this going to work? Would there be good outcomes in training? Would there be good outcomes with our patients? How could we form a therapeutic alliance across this two-dimensional screen? And yet, we were all very surprised and pleased to see that the good outcomes were there, that the connections were formed. Now, by no means is it the same as sitting in a room with someone face to face, eye to eye, but it did an amazing job. And we did go from complete avoidance to adoption. And perhaps the same thing will happen with AI. Now, you might just reflect, do you use an AI tool in supervision? If you do, please put it in the chat. We'd love to see what you're using, but we're not making the assumption that you do. And here's how our respondents responded. I have used AI tools in supervision. And here we see that 70% have never used them.
All right, I will take up the next few slides and we'll go through some examples of different AI tools that are being used in supervision. So first, let's give kind of the overview of the tools. I think everybody is most familiar with session notes and transcribing what's happening in a session. AI is also capable of providing case formulations, diagnoses, and recommended treatment plans. It can analyze a psychotherapy session for the variables most connected to positive outcomes. You can use AI for role plays and receiving immediate feedback. For research, oh my goodness, it can write a dissertation in like 6 minutes. It's phenomenal. And we can use it for clinical brainstorming and as a thought partner. So we'll go through each of these use cases and give some examples in the next part of the talk. And we also just want to clarify, we're not attached to any of these companies. They're simply examples. But I did see one person that we're going to be talking about, Dan Sachs, is in the audience. So maybe he'll jump in as we talk about what he built. So most of us are familiar with AI drafting session notes. I'm curious if you want to put in the chat if that's something that you do and the company that you use. I'm sure people would be really interested in what I hear here is in the Bay Area is kind of Simple Practice is the most popular. They're just rolling out their AI transcription service. There are lots of HIPAA compliant tools at this point. What people may not be thinking about is these tools can also be used to transcribe the sessions you're having with your supervisee, so helping to lessen that administrative burden. And then if you get really fancy, like our colleague in Australia, Chris Allen, you can provide AI rubrics to say, how am I doing in terms of best practice standards in how I'm supervising? Were there ruptures? Are you picking up on anything that I missed? Did I teach these basic skills? So that's, it's rare for supervisors to get feedback on how we're providing supervision, but that's another resource that AI can provide. It's also amazingly good at diagnosing. It might surpass our skills at diagnosing. We're not saying let AI independently diagnose, but this is one of the emerging properties that we're watching to see how's this going to change our field if AI is so good at diagnosing and treatment planning. This is the piece that I am most excited about, AI's ability to analyze psychotherapy sessions. When ChatGPT became accessible a couple of years ago, my brain lit up with finally, there might be a tool to get feedback about my work. When I went to school, it was during a time where we didn't videotape our sessions. Nobody saw me do therapy. I would see a number of clients, come talk to a supervisor and say, here's what I did. Do you think I did well or not? It was really frustrating for me as somebody who wants data and objective information about how I did. And so AI can provide some of that feedback and data that we can bring into our psychotherapy sessions. So this is one of my favorite quotes from one of Tony's articles in The Atlantic. And if you haven't read it, I highly, highly recommend you read it. It lit a fire under me years ago. Imagine a surgeon or a dancer learning without someone observing their work. That's the predicament therapist's in. Or another way I like to think about it is if you were supervising an artist and they painted away from you and came back and talked about their painting, but you never saw their painting. I have a little red here, a little blue here. Do you think I did a good job on this painting? How can I improve? It's hard to give somebody feedback when you don't see their clinical work. And AI can analyze sessions in a way that no human supervisor has time to review all the tapes of a supervisee's clients. It's not realistic. So one example of a company is Listen that I think is cutting edge. They've been on this for a long time. Zach Imel is the founder, the leader of this company. They have, many metrics that they're looking at in terms of how closely, for example, does a session follow the standards for motivational interviewing or cognitive behavioral therapy? What's the alliance? Are there ruptures? What's the talk time? What interventions are connected to positive outcomes? How does this therapist compare to the benchmarks that we know are connected to good therapy? It's really remarkable. It's like what I wish I had in graduate school.
And
And then
Milena,
you
can I just say one thing in here, sneak in, just to underscore that Zach Immel is a psychologist. And we don't often find, people in our field on the boards directing and implementing the research, the AI tools. So I just wanted to give a plug to our profession being represented.
Yes, and if you want to dive into this topic, Zach Imel, Imel, look at his research. He's been doing this for a long time. It is awesome. This is another study that he was involved in, kind of trying to give you a sense of what the dashboard looks like. How are you doing on this? It's basically giving AI a rubric and saying, can you grade me on these variables? How am I doing compared to the benchmarks? Where is there opportunity for improvement? And this is a really interesting article, and we'll give you links to the articles on the slides. So you have that. Listening to supervisors and students talk about how helpful it is to get the feedback, to get data, and to say, oh, okay, I'm at this level. What do I need to do to get to this level? What do I need to learn? And how can AI help me learn those skills? This is a quote from a supervisor. She runs the e-clinic at Palo Alto University, uh, where they use Elios is another model like Listen for evaluating psychotherapy sessions. She says, as a supervisor, I spend less time watching entire videos because Elios gives me a snapshot. I know where to go and listen to the most important parts. That lets me use my time better. And this is incredible as well. We're not just talking about individual sessions, one-on-one sessions. It can also provide amazing feedback in the context of a group. So I was lucky enough to do a demonstration group where AI had been, trained to give feedback on stages of group development, individual roles in the group, what happened in the group to allow the group to go from a more superficial level to deeper conversation. How are ways that the therapist could have improved and addressed different dynamics in the group better? We all got a printout at the end of the group of like, here's my relational issues, and I am in group therapy. It got me. It so got me in just this very short demonstration group. It is just so remarkable. Ah, Hannah, you're up.
Right. So another way that AI tools can be helpful is they can generate role plays with real-time feedback. And this is the section that excites me. I need the next slide, Milena.
I'm trying.
Oh, okay.
We're slow.
Thank you. And this is a platform that was developed by Dan Sachs, who's in our audience today. Welcome, Dan. Just thrilled to have you here. And I had the pleasure of just out of the blue calling Dan and talking with him, which was a wonderful conversation. And Dan uses deliberate practice. He's a certified deliberate practice trainer. And he uses deliberate practice from an AI point of view. And here we have some of the skills that on Dan's platform are available for the learner. And I have picked empathic reflections. And Dan has provided us with a rubric, skill criteria about what constitutes an empathic reflection. You need to reflect the main content, emotion, or meaning from the client's statement. Use the words that the client uses. Have a tentative, curious tone of voice, and do not doubt, solve, comfort, or try to calm your client down. So very explicit criteria. So you're presented as a learner with a client statement. I've been feeling really overwhelmed lately with everything going on at work and at home. It seems like no matter how hard I try, I can't satisfy everyone's expectations. This is all done in text. And then you are asked to respond, and I'm going to have you just imagine before I show mine. Imagine that you are going to respond to this client with
Or
an
put it in the chat if
introduction.
you want to share.
I'm sorry, what?
I was going to say they could put in chat if they want to share as well.
Yes. Oh, excellent, excellent. And then I will show you my response. This is my attempt to respond with an empathic reflection. I hear you are really overwhelmed at work and at home. It sounds like no matter how much effort you extend, it never seems like it's enough. Am I understanding you? I thought it was a pretty good answer. And here's what my immediate feedback is, which is extremely important in deliberate practice. So, my AI supervisor says your response is very good, but it specifies. It's not just being sycophantic and just saying something, glibly about very good. It's going to give me specifics as it closely reflects the client's experience and uses their own language. You used a question at the end, which invites the client to elaborate or correct your understanding. Great. But it says for the next attempt, try integrating a reflection of the core emotion more explicitly. You might consider acknowledging the feeling of overwhelm more directly to deepen the sense of understanding. Wow. Okay. So I've got some further work to do on this skill. And I can retry the same client statement, applying this piece of feedback, and I will get more feedback. Am I getting closer? Am I having successive approximations? So it's an amazing way to do deliberate practice. One of the difficulties with deliberate practice is that you don't immediately have that supervisor there, that expert there, who can in real time make a correction. But here, AI is ever present and has been, in this case, extremely helpful. Dan, do you want to add anything here? You could, can he unmute? Could give it a try, Dan. Let me just see. Maybe
Hi.
you.
Can you hear me now?
I
Yes,
can.
yes. Hi.
Hi. I'll actually point out one of the risks, dangers, or challenges for people using platforms, because I mean, you're going to see a lot of amazing platforms. One of the challenges with AI is that it it's not always under our control fully. And I think even in the example, Hannah, that you brought, it's a beautiful example from the platform, but it's not a perfect one, because I personally thought that you did state the emotion of overwhelm, and I think you'd done a good enough job. Someone who looked carefully would have seen, and maybe we would have liked the AI platform to say that was good enough. Let's move to the next one.
Mm.
And so, when using AI, always be aware that AI makes mistakes. AI isn't always godly and perfect, and we need to be aware of that as well.
Well,
Thank
thank you. I feel very vindicated, Dan. Thank you. But actually, I thought it was a good point that it made. And this depends on your attitude about being a student in learning. Is good enough, or do you want to go to the next level? So here's another platform, and this one is dealing with a specific approach. In this case, short-term dynamic psychotherapy. And I love this tool. Again, there are many now out there. You are given I'm going to try the pen again now that I know how to erase it. You were given a description of a patient, a couple of paragraphs. What's really lovely about this is you can switch up the personality style of your patient. This one is a dismissing patient, but you could have someone who's passive aggressive, or you could have someone who is obsequious, this is fabulous to get at that personality style you as a trainee might have particular difficulties with. The client is given a statement, kind of like what happens in Dan's instrument. And then the therapist needs to respond according to the short-term dynamic psychotherapy model, of course. And then the trainer or the supervisor gives their response, which presumably is a much better response. And then you can see how yours matches. Now we're going to get rid of the drawings. So here's something that a client says. I think it's interesting how many retirees turn to travel or new hobbies, but I think it's really just a distraction from the inevitable emptiness we all face after a lifetime of work, especially for those of us who dedicated themselves to their careers. Now, what would you say back? So here's my attempt. Sounds like from your experience of being deeply involved in educating children, I knew that from the history, you are realizing the emptiness that can be a consequence of stopping that work. You seem to allow that loneliness rather than push it away by traveling or getting involved with hobbies. Do I have that right? Again, I thought it was pretty good. And the feedback I got, and not the feedback, this is the trainer's alternative intervention. I hear you're discussing this with a lot of thoughtfulness, yet I sense a layer of discomfort beneath those ideas. Can you bring your attention to what you're feeling inside as you reflect on your experiences and the notion of emptiness? What sensations arise in your body at this moment? So that's very different than what I wrote, right? So that's what the trainer thinks is an on-target response, but different from mine. And furthermore, if we see the next slide, it points out those differences uniquely, the differences between what I said and what the trainer said on these 5 parameters, right? And showing why it's not adequate. Very, very personalized. It was just amazing. An extreme amount of potentially very useful information there. And the next. But I'm having some difficulty with like, why am I getting criticized for my response? I like my response. But here's one of the fascinating things about this platform is you can have a discussion with the supervisor. You can take issue with the supervisor, with the trainer. And that is amazing. So I said, boy, you as the trainer, you're going for emotional vulnerability right from the get-go. And I'm really concerned this will cause some resistance in the patient. So my approach, see how defensive I'm getting? My approach is to open up possibilities of getting to the emotional vulnerability by first supporting the patient's defenses, right? And I'm going to now the reason I'm getting into so much detail here, word for word, is I want you to appreciate the nuance. I want you to appreciate the clarity. And I really want you to appreciate the responsiveness to me, right? So the trainer says, well, you raise an important point about resistance, but in this model, you strike a balance between being direct and being sensitive to the patient's defenses. And it goes through, I'm not going to read everything in that paragraph, but it goes through an explanation why. So I say back to the supervisor trainer, so this approach is more direct and willing to go for emotions head on. And now I am going to read this sensitive response. Correct. It emphasizes a direct approach to emotions. However, it's important to remember that this directness is not about rushing the process. Rather, it's about inviting the patient to engage with their feelings in a safe and supported manner. It's a dance between challenge and support, meeting the patient where they are while gently guiding them toward deeper emotional awareness. By doing this, we can help them confront their vulnerabilities without overwhelming them. Wow. Wow. I found that extremely impressive and very satisfying to me as a learner.
And Hannah, there's a hand up. Do you want to take a question? Martina's hand is up.
Oh, sure.
Yeah.
I actually, I'll take this one, but actually it might be good to save the questions till the end. But if there's something that's not clear here, Martina, can I answer something?
Sure. I was just wondering about the first time when you showed the example of a clinician being in session with the supervisor, and the supervisor, or a client, and the supervisor is getting feedback right away. I was thinking the undivided attention about reading the comments on how they can do better, and was just wondering, you're not giving the client or the supervisee undivided attention or actively listening if you're reading the feedback there and there, like in real time. That's what was in my mind. That's all.
Yes, absolutely. Of course, these patients are all manufactured, right? These are all patients that exist in text and have been created. And now we do have, as I mentioned before, we can actually have patients who verbally yes, thank you, the client simulations that could provide that kind of opportunity to respond. But of course, they're not really able, to respond in real life as they exist as a simulation. And so they could be programmed to respond, but they're not real patients. I hope I'm understanding. Milena, you want to help me out here? Am I understanding the question?
I think that was a good clarification of this is, yeah, simulated role plays for people to practice clinical skills independently. Yeah.
Yes, there's no real patience here, which is the beauty of this, right? I mean, often you're put into a practicum placement and then you're practicing, but on a real patient, which really isn't practicing. It should be the performance, right? So that's the beauty of having all of this behind the scenes capacity to help develop those skills. So then when we're actually going into our therapy sessions, we'll be so much further down the road. Thank you, Milena.
And I just wanted to highlight this one company that was one of the first to come to the forefront to work on simulated clients. And it's at the point now where you probably can't tell the difference between a simulated client and a real client acting. And you can practice not just one-on-one therapy, but couples therapy, family therapy, group therapy, work with clients over a period of time. So it's not just one moment in time, but over several sessions. So lots of opportunities to practice outside of, what therapists usually have to do is it's like game day every time we go into a therapy session with real clients and practice for the first time. These simulations allow us to practice, to actually get deliberate practice before we move into game day. This is all your section as well, Hannah.
Okay. AI can provide consultation. And what do we mean by this? Using AI as a thought partner. I really love that description, or sometimes called a brainstorming partner. You could create a custom supervisor. You could create several supervisors online who could weigh in on your case. And you could ask them to brainstorm assessments, case formulation, goal setting, and interventions. But of course, I need to underscore, you cannot assume this is accurate. It always has to be funneled through, your experience, your knowledge, your clinical consultation, and so forth. But this is invaluable as a thought partner. And I'm using this now in my work on formulation and intervention. And Milena, when Milena and I first got together and we were just exploring this whole area now years ago, Milena said, well, let's create a bot of you, an avatar of you as a supervisor. And I have enough things that I've published, books, articles, research, actually transcripts as well, out there for the public. And so we could kind of turn ChatGPT, turn it to say, okay, read everything Hanna Levenson's ever written that's been published. And now we have, and then with some prompting and refining, which we don't have time to get into today, we could actually have the avatar formulate, plan treatments, come up with goals, even interventions that then could be thought about by me as a therapist. Does this sound reasonable? And I'll judge it against what I know about the patient and so forth.
Yeah, it's really fun to have the expert right there to say, is that what I would have said? Is that in my writings and research? So immediate feedback on how strong, accurate the avatar is.
And of course, you could have many experts, many supervisors comment on your cases, and that's fascinating too. Look at my case and give me input on the struggle that I'm having from a CBT perspective. Or what about a systems perspective, psychodynamic?
So I'll take us home now with how can you right now apply some of these learnings without having to go buy a special product or a tool? What's accessible right now and within, following our, professional guidelines. So as a step one, what I would recommend is with your students, with your supervisees, opening the door for a conversation. Chances are they are likely already experimenting and are familiar with the large, general purpose large language models like ChatGPT. That's probably the most popular one. And it's likely your students are finding ways to ask questions and to think about their clinical work. So we want to get a sense of what they're doing out there in the wild. And we want to make sure they're practicing in an ethical way according to our professional standards. And they may have some great ideas that we haven't even thought of yet. So we want to collaborate with our students and our trainees. What kinds of questions are they asking? What kind of tools are they using? What's been helpful? What's not helpful? What are their concerns? And my proposal is to try to reduce the shame. It's natural for people to go seek consultation and help and get curious and want to be learning and ask a machine that has, the entire library of our field in it to help us think through what's really hard about, our clinical work. So step one, my invitation is to just start asking the folks around you, how are you using this? And to try to reduce the shame. I think my experience, and Alex, let me know if this literature exists. There's just a lot of shame around sharing how people are using these tools. It's kind of like hush, hush, don't talk about it, but we're all kind of secretly using it. So I'm interested in bringing those conversations out into the open. And Sentio has created several really, really helpful handouts that I'm sure they will make available because they're open source with everything that they're learning. How can you use AI and general purpose models, which is what most of us are using on a day-to-day basis, to enhance your clinical thinking, support your clinical brainstorming? So they've got, a really detailed breakdown of instructions that we're not going to go into detail now, but you will have access to after this webinar. Most importantly, what we want to highlight is we don't want to put protected client information into an AI. Our responsibility is to protect our clients' privacy and confidentiality. So, the general purpose models are not HIPAA compliant. We want to think about it similarly to when we present, when we talk in public about our clients, when we are trying to get consultation from others, or we're sharing a case as a teaching tool. We disguise certain information to protect our clients' privacy. So we want to be really careful to do that as well. But even with disguising specific information, we can provide AI, ChatGPT, with a lot of relevant information that's going to be helpful to stimulate our thinking. So, I think it's perfectly fine to say, for example, and I stole this slide from Alex, thank you. And I'll put a plug in for his AI and mental health introductory class. He's got an advanced class, lots of yummy stuff in those classes. A woman in her late 20s, employed full time, recently divorced, is seeking therapy for symptoms of postpartum depression. Now, I may not have worked with a client with postpartum depression before. I might need some ideas, some links to resources. Where should I go to learn more about this? I think this is a perfectly reasonable thing to put into ChatGPT. So what are the prompts? How do we work with, and I'm using ChatGPT generically. You may have a different Perplexity or Claude, something else that you're using. We want to say, help me out. Please act as a clinical supervisor, an expert in emotion-focused couples therapy, an expert in schema therapy, whatever your model is. Help me with this particular case, this particular context, and that's where we add in our de-identified client information. And then what would I like help with? I'd like some help with a case formulation or treatment planning or specific interventions I should be thinking about. I might ask for, can you help me role play this certain conversation? Or I want to practice this particular skill that is part of a new intervention that I'm learning. And then I always like to tell it kind of how to give me feedback because AI can be so wordy and lengthy. And I'm like, just the bullet points, make it succinct, 2 paragraphs, or give me one thing to work on, however you want the information shared with you. And if you want an example, this is a link to Alex in class we were going through some different examples of some outputs, some responses you might get from AI to think about. And once again, it may be very long and wordy. And so we want to narrow in and focus. Okay, here's a piece that I'm curious about. This skill is less developed for me. I want to practice this conversation, this way of working. Let's role play that for a bit. Always, 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 we are not taking AI's output at face value, 100% true. I get to turn off my brain and not think about it. No, we're using our experience, our clinical judgment, what we know about our clients to assess the output that we are provided, just like we would if we were seeing a supervisor or asking a colleague for a consultation. We don't take everything they say and go run off and apply it. We have to run it through our lens of, does that make sense with what I know about the research, with what I know about my clients and my relationship with them? We also want to double check the references. I know there's lots of anxiety about hallucinated references. Absolutely. Was a lot worse, much better now. But now we can say, provide me those references. And then I can go check those references and read up on whatever I'm trying to learn more about. So if you're interested in developing more familiarity, literacy, comfort with AI, I'll just walk you through what I've been doing the last couple of years. And mostly it's experimentation. There aren't any textbooks yet. There aren't any instruction manuals for how to do this. We are all figuring this out together. So I do think it's helpful to look at the position statements for your professional organizations and see what they have to say. How have they been revising their ethics codes, their best practice standards for working with AI? Joining different professional groups. Most likely your professional groups are offering a lot of AI trainings at this point because it's pretty popular. And there are also different organizations that really focus exclusively on this. So for example, there's a Slack group called Therapists in Tech. There's Behavioral Health Tech, which has a conference next week. If anybody's going, I will be there. It's in San Diego. There is Society for Digital Mental Health. So these are organizations that are really kind of at the forefront of looking at the intersection of technology and clinical mental health work and clinical training and education. attending continuing education events. Lots, more and more are popping up. And most likely in the next year, we're going to start to see events around how do you develop AI competencies and what does that look like to integrate that into our educational and training programs. Just like we had to develop competencies for learning how to do telehealth. That was new for all of us. And so then you started to see legislation around, okay, you need 4 hours of training in laws and ethics around telehealth. That's probably coming for AI. Masterclass Coursera have kind of fun little modules that you can take at kind of beginner level, which is what I did. Really good stuff. You can follow different experts on LinkedIn. I am not an expert, but I care deeply about this field. And when I read a book, attend a training, I try to write a summary and put it up there. I think Ethan Mollick is a really great person to follow if you're looking at just kind of the general field of AI. He's an educator, business school educator, but writes a lot of really accessible material. The American Psychological Association, the American Psychiatric Association on their websites both have rubrics. If you're thinking about experimenting with an AI tool that's not kind of a general purpose tool, there's rubrics for kind of evaluating, is this a reasonable tool that I should consider? What should I be thinking about when I'm looking at working with an AI tool or adopting a tool? And then love Sentio again for developing a competency checklist. I think this is a great checklist for ourselves, but also if we're working with students and supervisees, working through with them, what are the skills they need to develop for this new world where there is a thing called AI. And then if you are a supervisor and you haven't taken our survey and you would like to, we'd love to hear how you're thinking about AI. So feel free to scan this. It just takes kind of 5 minutes. It's a pretty brief survey, but we would love to have you do that. And I'm going to turn it back over to Tony and Alex for questions and conversation and sharing more about all of the great stuff that you do at Sentio.
Well, we could spend many, many hours, as you know, and we're just about to wrap up for the hour, which is a shame because we could go on and on. I guess the only thing I want to say is, first of all, there is a temptation that we have seen in when we're talking about AI stuff in thinking too far ahead in time. So a lot of conversations that we're having with our colleagues is what's going to happen to our field in 5 years? Will I have a job in 10 years or whatever, right? And our main kind of recommendation is to try to stick with the present. There is already so much happening right now that you can spend literally your whole week just reading about the latest development in the field of AI and you'll never get bored. Like we try to do that and we still feel like we're always playing catch up. So that's one of the main things, because I know a lot of people might veer towards future kind of prediction, but as Hanna and Milena have shown very well, I think there's already a lot that we can do and explore and create together with the tools we already have. And yeah, I think what I'm going to do as well, I'm going to put a link here on the chat for Milena had mentioned some of the trainings that we are doing on this. So if anyone wants to do a kind of more in-depth training on some of the things that Hannah and Milena have been talking about today, feel free to check out our website for that. Please feel free to collaborate with Hannah and Milena because what they're doing is, I think, very brave, very cutting edge. And just to emphasize another point from Milena, I think we do need to talk more about it also because of that shame element that Milena mentioned before. I have seen a very interesting pattern also in the AI CEOs, the CEOs of the companies, where they started off by saying, no, people aren't using AI for personal therapy. What are you talking about? And then changing to, well, yes, they are, but we actually didn't create AI for that purpose. So it's their fault. And we really, like it's, don't count on us to talk about that. And now it's changed into, yes, they are using it and we have to do something about it. So we are at a tipping point where now finally there is a little bit of an open door where we might provide some influence as experts in the field of mental health. I don't think we're going to be able to convince Sam Altman from OpenAI to do major changes, but we might be able to contribute in our own way to it. So that's like the cliff note, Milena. I don't know if there was anything more that would be worth elaborating on, but I just want to thank you for like everything you presented today because I think it's very important.
Well, I love that you are leading the way and making all of your information accessible. And I mean, it's very easy to think about a dystopian future. I am trying to hold on to what's possible. How can we take advantage of this new tool that we haven't had before? That's where I'm trying to direct my energy and just having conversations. So I'm on LinkedIn if you want to find me there and have more conversations. I love to talk about this topic and I'd love to hear what you're doing. Reach out anytime.
Yeah, I think we have one burning question. If anyone wants to have one last burning comment or question for Hanna and Milena before we close off for today, feel free to jump in. Ready, go. And Hanna, if that does not happen, any last words you want to give the group?
Well, just thank you for your attention. We're all entering this new world, and we need to apply everything that we know about our ethics and our concern for our patients, and at the same time, become more literate so that we can have the best training and best patient outcomes possible. Thank you all.
Very nice way of phrasing it. All right, everyone. We hope to see you on the next one.